I grew up in Syria and came to the United States about 25 years ago. And I've been local to the area for the last 14 years. The main thing that drew me to Cooper Inspira Neuroscience is the ability to provide healthcare and expand and elevate the services of neuroscience in South Jersey. So I'm heading to Inspira Medical Center in Mullica Hill. We are going to tour the new tower and the expansion project. So the expansion will provide us with Neuro ICU. It's a dedicated space for our neurological patients, both neurology, neurosurgery, and that will help keep a lot of our patients in the region closer to home.
Dr. Hakma, here we are in this new space. It's so exciting to be here with you.
This is amazing. This is my first time visiting the site and looking at the new facility and the new
It's hard to imagine all the stuff that it takes to build a building like this.
It is fantastic. I mean, the facility and the space looks wonderful.
And one of the things that's been most important, I know, as we talk about it is when we think about neuroscience, having the support of family members and being able to be close to home.
Absolutely. The proximity to your doctor, to the hospital is essential. When you have a sick parent, and I experienced that personally, that you have to drive him an hour every other day to see a physician or get an infusion, it takes a toll on the patient and the family. Providing that for the patients and the family in their backyard is very, very essential. And having an ICU like this will allow us to do that here.
And that's one of the whole tenets of our relationship, is that physicians like you, with all of the skills that you bring, are actually here in our community.
Absolutely.
For driving the services as the director, obviously, but you're also providing the services and recruiting people who want to be part of a large academic center like Cooper, but want to be able to do the work in a large teaching hospital, which is what we have in our community.
Absolutely. And, so that's one factor, the proximity to the family, but also time, right?
Yeah.
When you have an acute neurological condition such as an ischemic stroke, time is brain, right? So if the patient shows up in the ER here or in Vineland, as opposed to waiting to be transferred somewhere else, we can provide the services right here on site.
And I know you were very instrumental in our recent stroke survey, where it's interesting to see the surveyors were even so excited about the work we're doing.
We have a wonderful team here, and the care that we provide for stroke patients in this institution is phenomenal, and I'm excited to take it to the next step.
Well, let's go take a look at one of the rooms.
Yeah. Oh, it looks wonderful.
It does. I love how bright it is, and I know
very spacious.
Yeah.
You have neuro nurses. They're trained on monitoring the patient's exam, they detect any changes. You have dedicated physical therapists that are going to come and mobilize the patient.
And we actually have interventional radiology that's going to be just downstairs, so that's another opportunity.
You have facilities you can get a quick CAT scan if you have to, if there's any change. We're going to have a biplane, and that will be the hub for neurointervention. And we already started doing procedures here in Mullica Hill. We've started the carotid stent program. We've done a few already. And the next step to elevate it is to start doing thrombectomies down the road.
Yeah, I'm excited about it. I know it's
very excited, yeah.
But maybe we can also just spend a little time to walk down and talk about the new epilepsy unit. And that'll, again, another addition close to home. There's sort of magic behind the walls that we get to see. It's just amazing. This will be additional ICU beds and a 4-bed epilepsy monitoring unit. Epilepsy is one of those things that it's so important for families to have that close proximity, again, as we talked about before, but really, especially with children, and really making sure that we have the expertise and as well as the space for you to be able to do that work.
I applaud Inspira for investing in such a program. You don't see that happening in a lot of the hospitals in the region, right? So the fact that the Inspira and Cooper are investing in the program here, and they will have the university tertiary care level neurologists looking at from Cooper, looking at the EEG, interpreting the EEG, and providing the care for these patients.
We are so grateful for the Cooper and Inspira relationships, and we have it in cardiac, we have it in neuro, and it's just, it's wonderful to see it thriving and growing. So thank you, Dr. Hakma, for your leadership.
I'm very, very proud to be part of the team. Very happy to be here. So.
I know I need to let you go to surgery, so thanks so much again.
My pleasure. Thank you so much.